Hey, how you doing? This is David from Elevated Physical Therapy and Fitness. Today I'm going to go over a technique that I often give to patients who are having some SI joint trouble. One of the things that's important with this one is it does require a little bit of assessment that's hard to do for yourself, but we're trying to correct when there's an over rotation of one of your pelvic bones or the other. Sometimes it's both. So if it's hard to do this one without having it be prescribed to you by someone else, but it is one that you can give it a shot. Just if you're having some discomfort, right-sided, left-sided, it's specifically more one side or the other, and it's that belt line pain, this one can be helpful for that. Okay, so what I like to do is have some type of dowel, PVC pipe, a broomstick, any kind of solid object that's long enough to go between your legs there. So what I'll demonstrate is if my right pelvic bone was rotated too far forward, I had an anterior tilt of that right innominate, I'm going to demonstrate how to correct that one, okay? And there's any number of ways you can do this, but essentially I'm going to try and, instead of letting that stay forward, I'm going to try and use my own muscles to help correct some of that positioning. So I'm going to use my glutes on that side to go there. And usually what I do is I counterbalance that with the hip flexors on the other side. So you're gonna lay down with the knees bent up, get into almost like a dead bug type of position, and I'm gonna put this dowel behind that side because I want this glute activating to pull a little bit there, okay? Now I'm just gonna hold this steady, and I'm gonna drive that right foot down and drive the left knee up. I'm not moving this, I'm not allowing this to move, and it's not a maximal contraction. So it's not a huge isometric here, but I'm just activating these muscles and holding for 10 seconds and then relax. And again. Okay. Again, if you don't know what direction things are rotated and stuff, sometimes it's hard to, do this exercise without a little bit of guidance, but it is something that I find to be pretty useful when we're dealing with like a specific one-sided low, SI joint pain, or sometimes as like a preventative measure for something along those lines if it's a chronic issue for you. But if you have any questions about that, go ahead and leave a comment or reach out to us directly. We can help you out with those. If not, give it a shot. Let me know what you think.